Okay, hello and welcome to the New to Medicare Claim and Simple webinar. I am Bailey Lawson. I'm a specialist on the Provider Outreach and Education team or PO team at WPS. I am joined today by my friend and colleague, Mary Muko. You heard her voice a little bit earlier. She's active in the chat. We are here to help you today and welcome. Okay, let's get this party started. So the objective that we have for today is you walking away with an understanding to the basics of the Medicare claims process. One thing that I do need you to remember is this is very high level. I am not going to go into a terrible amount of detail because this course is designed for those who are new to Medicare and have 6 months or less of experience. Of course, you can use it as a review as well, but it still will be very high level. If there is something you would like more detail on, definitely check out our YouTube channel. We have playlists broken down by topic, and I'm going to have Mary add a link to the YouTube channel, as well as links to playlist dealings with claims specifically, since this is a claims event. However, there is a plethora of playlists for you to choose from, so even if there's a different topic that you want covered, we most likely have it on there for you, so just check that out. I just want to make sure you're aware of that so that if you are looking for something specific, you can find it there. Now, how are we going to achieve this objective? Well, we're going to be going over patient, provider, and Medicare responsibilities. So let's do that. Before we get into responsibilities, I want to first talk about claims in general. This will serve as the building blocks of your knowledge with Medicare claims. So let's talk claims, shall we? So Medicare defines claims as requests for payment of benefits or services a patient receives. Medicare requires providers that furnish services that may be covered to submit claims. You can, you can't rather charge patients for completing or filing a Medicare claim. This process is important to understand because we want you to have the knowledge and ability to submit accurate claims as well as all of the required documentation needed when submitting that claim. The documents that you are submitting would be what would show support of the medical need of that service that was provided. It's also important that you as the provider keep up with Medicare billing policies so that you're submitting accurate claims and you are submitting accurate and required documentation. Now, when filing fee-for-service claims for patients enrolled in original fee-for-service Medicare, submit claims to your MAC for covered Medicare Part A and B services. You can contact your MAC, which, by the way, is Medicare Administrative Contractor. That's what WPS is, a MAC, Medicare Administrative Contractor. If you have any questions about this, for WPS, that would be contacting customer service specifically because they have all of the info and access that you need to get your questions answered about your submitted claims or submitting claims. When it comes to charging patients, you can bill a patient for the following items as they apply to your provider type, unless the patient's supplemental insurance covers the cost, of course. So those things include unmet Part A deductibles, first 3 pints of blood, which Medicare calls the blood deductible if there's a charge for blood or the blood isn't replaced, Part A coinsurance, and services that Medicare doesn't cover. Some things to consider and look out for when filing a claim and expecting coverage or payment from Medicare are, does the claim meet a benefit category? Is it specifically excluded from coverage or not? And is the service you're submitting the claim for reasonable and necessary? So is there medical necessity? These are all things that will be looked at on our end as the MAC, Medicare Administrative Contractor, when you submit a claim. So those are all things that you'll want to keep in mind. Some things you will want to make sure of before filing that claim is that the applications are complete. This would be applying for a National Provider Identifier, or NPI, you may hear it referred to as, which you will be using a lot in the Medicare world. You will need to know when not to file a claim. So this would be if a service is furnished outside of the United States, if it's a non-covered service, unless the exception to that is if the beneficiary requests submission of a claim to Medicare, you opted out of the Medicare program, or the Medicare program itself has excluded or debarred you from the program. You'll need to determine Medicare secondary payer status. So first you will file with the primary payer if the patient does have another plan, insurer, or program that will be the primary payer. And lastly, you will want to collect out-of-pocket expenses, those being things like copay, coinsurance, deductible, or out-of-pocket expenses that the patient needs to meet within their plan. So now that we've gone over what claims are, let's talk about the types of claims there are. So first, under Part A Medicare, you will have 837I electronic transaction and UB04 claim form. You'll recognize this. If you're new to Medicare, I know some people who had registered for events in the past have said, I don't even know what claim form I bill. So you would have seen this in your registration process. This is what those mean if you were unaware. So for Part A, remember, this is what is referred to as hospital insurance. Part A helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Then we have Part B, which includes 837P electronic transaction and CMS 1500 claim form. And remember, Part B is referred to as medical insurance, and Part B helps cover services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, which is things like wheelchairs, walkers, hospital beds, and other equipment. And you'll hear the acronym for durable medical equipment, DME. And then many preventative service like screening, shots or vaccines, and the yearly wellness visit. So the annual wellness visit, you'll hear it called as. So those are the types of claims. Moving along to initial claims, providers submit initial claims for fee-for-service payment for the first time. Hence the use of the word initial. It is your first claim submitted in the process. It is your initial claim. Submit initial claims electronically unless you qualify for a waiver or exception from this requirement. So you may be thinking, Bailey, what does an initial claim include? Well, clean claims submitted and processed, resubmitted previously rejected claims, claims with paper attachments, demand bills, claims where Medicare is primary or secondary, and non-payment claims. Now, I threw a lot of words at you, and I want to explain what this list means. So first on the list is a clean claim. A clean claim is a submitted claim that is complete, accurate, and requires no further information from the provider for processing, allowing it to be paid quickly. It doesn't require a Medicare Administrative Contractor, or MAC, if you remember, to investigate. A rejected claim doesn't meet the basic requirements for legibility, format, or completeness. Medicare doesn't consider these claims received until the healthcare provider resubmits them as new, corrected, and complete claims. Demand bills are both a principle and mechanism of Medicare. The principle says the patients have the right to demand you bill Medicare for services provided to them, even if that billing doesn't result in Medicare payment. Non-payment claims are submitted claims that the healthcare provider doesn't expect payment for, but is notifying the payer of a period of non-payable confinement or termination of care. So that kind of explains that list a little bit more. Some more on initial claims is that initial claims don't include adjustments or claim corrections submitted to MACs on previously submitted claims or appeal requests. And remember, MAC is Medicare Administrative Contractor. And I want to just say, I keep reiterating the abbreviations, the acronyms, because I want to make sure those new to Medicare don't get lost when I'm saying MAC. I want you to know what it means. So for those of you who do know, I apologize, but this is just for those very new providers. So now that we are all caught up on all of the base information on what a claim is, what type of claims there are, now let's talk about how submitting a claim works. So first thing is first, step one, the claim begins when a beneficiary receives services from their doctor or provider, and then that provider submits the claim. So step one, obviously, provider submits the claim. Step two is that once the claim is submitted, it is either received by MCS, which is the multi-carrier system, or FIS, the Fiscal Intermediary Standard System. And I have those listed right there for you, just so when you refer back, you have those acronyms listed out. FIS is where Part A claims go and are processed, and MCS is the system where Part B claims go. Part A providers are submitting their claims requesting repayment for use of facility, equipment, and overhead costs. And the three ways they can submit those claims are: one, electronically; two, through direct data entry, and you'll hear that as DDE. This is where providers manually key the claim in office. And then three are hard copy, by hard copy or on paper, to be manually entered by WPS staff, by the MAC. All edits will need to be corrected before they can continue in the process. The presence of edits, which is known as reason codes in FIS, may cause the claims to be returned for correction, rejected, or denied. So when a Part B claim, a Part B provider submits a claim requesting payment, they're being paid separately from Part A claims, and those can be submitted electronically or by hard copy or paper claim. And a few examples of items checked on claims through the MCS system, and they're mostly the same between MCS and FIS, but they're a little different, so I'm just going to let you know what they are. So for MCS, it would be a valid date of service. Procedure codes are Medicare approved codes. Age and gender of the patient matches the type of procedure. Diagnosis codes are in appropriate format and valid for the procedure submitted. Any errors on the claim are called edits, just a little tidbit. The presence of edits/audits in MCS may cause the claim to be unprocessable or denied. So that's MCS. Some examples of what FIS checks for, and FIS is Part A, remember. And again, the list may look a little bit of the same, but I still wanted to list them out because the terminology can be a little different between FIS and MCS. So FIS checks for date of service, Services are covered by Medicare. Age and gender of the patient matches the type of procedure. There is no duplication or overlap. Benefits are applied correctly. And again, any errors on the claim are called edits. So that's step 2. It's received. The submitted claim is received by MCS or FIS. Step 3 is the claim cables to the Common Working File, or CWF. And this is maintained by the Social Security Administration, and it holds master files for each beneficiary with Medicare coverage. It receives and it being Common Working File, it receives a nightly batch of all claims filed that day by WPS and I should say the other MACs that are sending into Common Working File. This process is known as cabling and allows claims to mingle with all of the other claims for that beneficiary. So what Common Working File, CWF, looks for is entitlement. Does the beneficiary have entitlement to the services that were performed? For example, for an inpatient claim, do they have Part A coverage? For an outpatient claim, do they have Part B coverage? It looks for benefits. The system will apply the proper benefits according to the record. So for example, for Part A, days applied on inpatient claims, deductibles, and for Part B, deductibles and coinsurance. It'll look for duplicates and overlaps. So has another provider billed for the same service, or is it overlapping a previously billed service from another facility? For example, are there 2 claims for the same dates of service? Common Working File, CWF, will also check to see if other payers are involved. This includes Medicare secondary payer, MSP. Was the injury due to an accident, or are they still working and have coverage through their employer? So Medicare becomes the secondary payer. Medicare Advantage or Health Maintenance Organization, HMO, or Medicare Advantage, MA. Have they chosen a Medicare replacement plan for their Medicare coverage? And so that's step 3. So step 4 is after the Common Working File, CWF, checks for all those things. The claim will be finalized by WPS in FIS for Part A or MCS for Part B. So once the claim passes from CWF, Common Working File, it will return to FIS or MCS and enter the payment floor. An approved claim, if submitted electronically, would be held for 14 days. An approved claim, if submitted on hard copy, is held for 29 days. A claim is not held at all if it's rejected or denied. Step 5, the processing is complete. So if the claim is approved, the Part A or Part B provider is paid through electronic funds transfer or via check. If the provider disagrees with the decision, they can request an appeal or submit a reopening. An appeal can be requested electronically or by hard copy. A reopening can be requested electronically, by hard copy, by telephone, or by email. So now let's get into patient responsibility. What do they need to take care of on their end? So most importantly, the patient needs to keep their records current. They need to do this to maintain eligibility. When they are making updates and keeping those records current, they will go to the Social Security Administration, SSA, or Medicare Advantage, depending on what their plan is through. So Medicare Parts A and B will be the SSA, Social Security Administration. If they've opted for different coverage, it would be Medicare Advantage, MA. In some cases will be the Railroad Retirement Board, just depending on where they get their eligibility through. Here I have different types of insurance cards. You will be able to tell who they had their insurance through by looking at the cards. If you look at the first two in the front, all the way on the right here, these are Medicare cards. You'll know who has deemed them eligible and who they need to go to for their eligibility and things like that by the red bar at the bottom. So you can see here it says Railroad Retirement Board, and then this one will say uh, Social Security Administration. I'm not sure if they use the acronym SSA, but it'll be written down there. The next two back here are examples of cards you would see if they had Medicare Advantage plan. This is a responsibility that would be the patient's to show you those cards. This would be the patient giving the primary payer information. That's something that is the patient's responsibility. A patient must give you primary payer information. And I'm just giving you an example of what those cards may look like. Another responsibility of the patient is to give you permission to file. This can be done with a signature on file card. This is where a provider obtains a patient's consent to bill and submits claims without a physical signature on every form. Providers use a signature on file authorization form to document this kind of consent, which is then stored in their files for claims. The patient signs this form once, and the provider uses an electronic indicator or signature on file process when submitting those claims. If the patient for some reason does not give you permission to file, document that they don't want you to file, and this will show that you are not violating the federal law that says you must file the claim. Just make sure you document it. The patient would then be responsible, or the supplemental insurance would be responsible for that bill. If the patient only wants their primary insurance billed for some reason, document that as well. If the patient does end up giving you permission to file later on, you will need to file within a calendar year of receiving that permission. So I've added in some of these patient resources for you, and I've labeled it patient resources so you can differentiate between the two, because there are some similarities between patient and provider resources. But while these are for patients, they are still great resources for providers, especially providers who are new to Medicare. Whether it be to use it to learn yourself, or you're helping a patient to understand. It's great to see things from a patient's perspective. So I'm going to pop over the new to Medicare, the Medicare and You handbook, just to give you an idea of what it looks like. Let me pop this over here and make it a little bit bigger for you. So this is the Medicare and You. This is 2026 version, but you can see as you go through, it's for the patient. But I want to show you the table of contents. So you can learn about original Medicare here. You can learn about Medicare Advantage and other plans, Medigap, Part D, get definitions, helpful contacts, things like that. An index gives you an idea of how many topics are in here. But although it's for the patient, it's very good for a provider who is, who is new. Keep losing my voice. Who is new to Medicare, because it gives it to you in a way that's very high level, kind of like I'm doing. But it's all there in a handbook for you. And then the CMS website, I'm going to pull this over. This is actually where you get the handbook that I just showed you, Medicare and You. But this is the patient resource. But again, this is very great for someone who's new to Medicare, because it gives you a bunch of information in layman's terms, in very high level terms. Because if you're looking at the CMS website as a provider, the terminology may get confusing to you. So this is a good resource to use as a new to Medicare provider. I'm going to pull that back over. I do include this on every new to Medicare event because the information is very useful. Like I said, I'm going to have Mary add some of those resources, and you can click right in here for this, but I include this in every new to Medicare event, like I said, but I'm also going to be having Mary, just a quick note. I have her putting things in the chat. Just be mindful of that, because these aren't resources that are necessarily in the handout materials. But I'm also going to have Mary add a registration link to the chat. This is for the Journey to Medicare Success. Speaking of new to Medicare series, this is the Journey to Medicare Success webinar. It's not my webinar, it's my colleagues, our colleagues, Leanne, who hosts it. And it's very useful information for those who are looking for information on provider enrollment. So I want to make you aware of that because it's specific to provider enrollment. And I want you to have that information. If you have any questions or are confused on provider enrollment, she'll be able to answer those questions for you. It's right in the chat for you. I had Mary add that for you. But moving on, let's go to provider responsibility. So, stating the obvious here, as a provider, you must enroll in Medicare. The exception to this rule is VA providers cannot enroll in Medicare to be paid, but they can enroll to refer patients to outside source providers. These are Medicare providers not eligible for payment. So that's the only exception to this rule, are VA providers. But you must enroll in Medicare. And and this is why I kind of added the provider enrollment a little bit earlier, had her add the Journey to Medicare Success, because we're talking about provider enrollment, but I'm gonna lightly touch on it. During the initial enrollment period, this is where it will be checked that you as a provider meet all of the federal criteria to be a Medicare provider who's eligible for payment. And you'll need a current state license. This is also, I had mentioned electronic funds transfer. This is where you'll set up that electronic transfer. Oh my goodness, I'm just jumbling all the words. Electronic funds transfer. This is how you'll get paid. If this information is not kept up to date, payments may be suspended. And every 5 years, you will be required to do a revalidation. So make sure to do this, because your payments can be suspended if you don't revalidate. And furthermore, if you are a supervising physician over someone like a physician assistant or a nurse practitioner, this can suspend their payments as well if you don't revalidate your enrollment. So it's also your responsibility to complete that revalidation. So the next responsibility of the provider is to document services that are performed. These can be handwritten or typed electronically, but either way, these need to be done, because it cannot be legally proven if you've not written it down. And if it cannot be legally proven, then it cannot be paid for. So some things to keep in mind when writing down your documentation is that it must be complete. An electronic signature does count when completing these forms. It must be legible. And a key point with this is that this does not just mean penmanship, legibility of penmanship. It means acronyms as well. So if you're using an acronym that only you know, this is not a legible document. So if it's just write it out when you're documenting, rule of thumb, because you don't want to take the risk that it's a acronym you're using and it doesn't mean what you think it means. It must also show medical necessity. The only exception to this would be preventive services, and that's because this type of service purpose is to prevent a disease from occurring in the first place, but otherwise it must show medical necessity. You'll need authorization of filing, and you will need to know, you'll need to bill in the correct order. So this the service is complete and the documentation is done. Now what? You as the provider need to determine who to bill. You have a few options here. Are you billing under the Medicare umbrella? Is it Medicare Part A and B? Is it a Medicare Advantage plan, which is Medicare Part C? Is it home health and hospice, or is it, which can be referred to as HH? Here I have HHH, but you can see it with an ampersand where it's HH and H. Those are just a little bit of acronyms you may see with that. Or is it durable medical equipment, DME? Is there other insurance to be billed, like supplemental insurance? Or is this an out-of-pocket expense the patient needs to cover? But that's what you'll do. You'll determine who to bill. Now that you have determined who to bill, you will complete a claim form. So here you will transfer the information you have documented during the service onto the claim form. Then you will submit the claim to who you determined to bill, and it will go through that process we talked about earlier with the life cycle of a claim and do that all of that processing. You must submit Medicare claims with the correct MAC, Medicare Administrative Contractor, no later than 1 calendar year after the date of service. For inpatient services, it is 1 year from the date of discharge. And for outpatient services, it is 1 year from the date of service. Medicare will deny claims if they arrive after the deadline, with a few exceptions though. When Medicare denies a claim filed after the timely filing period, the denial isn't an initial determination and it isn't subject to appeal. And I do just want to briefly mention the exceptions here. So, administrative error. If failure to meet the filing deadline was caused by error or misrepresentation of an employee, Medicare contractor, or agent of the department that performed Medicare functions and acted within the scope of its authority, administrative error. Retroactive Medicare entitlement, where at the time of the service was furnished, the Medicare patient wasn't entitled to Medicare and then subsequently gets notification of Medicare entitlement, retroactive to before that date of service is an exception. Retroactive Medicare entitlement involving state Medicaid agencies, Medicaid agencies. I just want to make sure that I didn't blur that and you could hear that properly, but this is where at the time you furnished the service, the Medicare patient wasn't entitled to Medicare and later got notification of Medicare entitlement retroactive to or before the date of service, and a state Medicaid agency recoups the payment for a provider or supplier 6 months or more after the date of service. So going back to the retroactive. So retroactive just means it goes back to a certain time. So let's say I had a service done in June of this year. And at that time I did not have coverage. And we are now in November and I was granted retroactive coverage back to March for whatever the reason may be. I would then be granted that coverage for the June service that I received because of my retroactive service. So retroactive just means it goes back, even though I didn't have it at the time. So you're kind of like a time traveler a little bit. Next, we have billing the patient. Billing the patient is also the responsibility of the provider. This will be collecting what the patient owes for the service provided. And this can be anything like a deductible, which I had mentioned these things earlier, but I'm going to tell you kind of what they are now. But a deductible, which is the amount of money the individual must pay out of pocket for covered healthcare services before the insurance plan starts to pay its share. So with a plan, you have a $5,000 deductible. You have to pay all $5,000 by yourself before the plan will take over. It could also be coinsurance, which is the percentage of what the individual will pay of the healthcare cost after meeting that deductible. So after I met that $5,000, now I'll pay, let's say, 20% of that service, and then Medicare will pay 80% because I've met my deductible. Or a copay, which is a fixed dollar amount for a service. And then, of course, non-covered items are services that are not covered, and that would be, things that are not deemed medically necessary. So that would be the patient's responsibility. And you would have to bill the patient for that, or the provider rather. So we've talked about what the patient is responsible for. We've talked about what the provider is responsible for. Now let's talk about what Medicare is responsible for. This is us as the Medicare Administrative Contractor, or MAC, as you have heard me say many times. But what is Medicare responsible for? So this is exactly as it sounds. We are responsible for making sure that we follow Medicare guidelines. This is the Social Security Act under Title 18, and this is the law enacting Medicare. This has everything from who is eligible to what services are eligible or medically necessary, as you've heard me say. Under that, Title 18 is the Code of Federal Regulations. This is the codification of regulations, and to codify means to arrange rules, laws, or information into a systematic and logical code or system. So that's under Title 18. And then under that, then we move into the Internet Only Manual, and you'll see that as IOM. And this is the day-to-day operating instructions. It is also Medicare's, I was going to say the Medicare Administrative Contractor, which is still true, responsibility to not only process the claims, but also explain to you as the provider what happened, and even the patient, what happened with your claim. Was it processed? Was it not processed? And why did this happen? If a claim was unprocessable, it means that the claim was never officially processed because it was submitted with missing or incorrect information, not because it was denied. These claims cannot be appealed and must be corrected and then resubmitted as a new claim. Common reasons for an unprocessable claim can be incorrect patient details like the Medicare number or name, invalid provider information like NPI, National Provider Identifier, we talked about earlier, and improper or missing codes for procedures, diagnoses, or place of service. A return to provider claim is a claim that has been sent back to the provider due to incomplete, incorrect, or missing information. A paid claim refers to a request for payment that has been successfully processed and for which the funds have been or will be dispersed. A denied claim is when insurance refuses to pay a claim, often due to errors or lack of medical necessity or procedural issues. After the MAC has processed your paid claim, the MAC will send you an electronic payment, which you set up during enrollment, along with the notice of a payment and adjustment, and this is known as remittance advice. I'm just wanting to add all my words together. I'm so sorry. So your MAC or Medicare Administrative Contractor will review those initial determinations and review those decisions that are submitted to them. This is a separate process, and I'm not going to go into great detail on it because we're going to keep it very high level, but it is their job to review that initial determination, whether through the appeal process or reopening. So these are some resources for you as the provider. We've got claims guides and resources. I've had Mary add these throughout the chat as I've been talking with you guys. So you have that there in the chat. In addition to this, resource specifically, but I've also had her add different ones. So you have a plethora of resources, but out on the website here, let me open this up. We've got a little bit of time if it'll let me. Here we go. So here we've got, I'm in the topic center and I'm under guides and resources for claims. And these are great guides and resources for you. So if you're part A, which I'm selected under that jurisdiction, we've got the direct data entry overview for you. If I switch over to Part A, we've got common claim denial, or I'm sorry, Part B, common claim denials, claim status resources. So you can kind of click through here. It's not one specific resource that I have linked in that PowerPoint, but it is rather the whole list of resources for claims, and you can kind of go through based off of the topic that you're looking for. We talked about Medicare secondary payer. We've got stuff here. We've got a fact sheet for you. So I just wanted to make you aware of that it's the whole list, not just one specific one, but I had Mary add in the chat earlier specific resources. So here are some more resources for you as well. All right, I don't think there have been any questions in the chat, and if there have been, I'm sure Mary answered them, but Mary, have there been any questions in the chat?
There was only one question, and I answered it and shared it out to everyone when I was sharing one of the many resources that you talked about today, Bailey. So as of right now, I don't see any new unanswered questions in the chat.
Awesome. Thank you so much for your help, Mary, in answering that question. I will talk about in a little bit how you can send follow-up questions if you're thinking about it and you're like, oh, I should have asked that question. I will tell you how you can do that. So moving on, in a few minutes, you'll receive an email with the subject, thank you for attending. Do not delete this without reading it. This email contains your certificate of achievement. The email will look like the emails that you have been seeing for your reminders if you signed up, registered rather, early enough for those emails to come in, and you'll find your certificate under the certificate heading. It's not a PDF that's attached, it's under a heading. This will have your name, contact hours, all of the things that you need for CEUs if you are submitting our certificate of achievement for CEUs. If you don't see this email, you may have actually gotten a different email. So if you're calling in on a phone and you didn't log in through WebEx, you may receive an email that says, sorry, we missed you. This is because you didn't register with your phone number. So WebEx doesn't recognize you as attending because it's looking for your email, not your phone number. That's not a problem though. Just email, Mary just put it into the chat, wps.gha.education@WPSIC, and put the webinar's name and date in the subject. And then let me know the phone number you called in from and I can get you the certificate if you need it. If you're not seeing any of these, you may just need to, these emails, you may just need to add WebEx, the WebEx email address to your safe sender list. And so if you do have follow-up questions, if you think of any additional questions, even after the event is complete, have no fear. Like I said, you will have a chance to send that in to me. You'll have 7 days to submit them, and you will want to send that to our education mailbox, wps.gha.education@WPSIC, like the one Mary had sent in earlier. It's all the same email. Just put again, today's date and then the subject. So this would be NTM claims, just to simplify it, in the subject line. This will ensure that your email goes to the right person, me. Now, since this is a claims event, I want to say claim specific questions about a claim itself. Like I can answer the questions about the topic of claims, but if you have a claim specific question about a claim you're submitting or a claim that you got remittance advice on, or a claim that got denied. I cannot answer those questions for you. You will have to go to customer service because I just don't have the access to the information I need to be able to answer your question about a specific claim. If it's about what you learned today, I can answer that question. So I just want to be very clear because I don't want you to get frustrated if you get turned around and they tell you to go to customer service and you're like, well, Bailey told me to send questions. We just don't have access to that information, and I do apologize, but that's just something we don't have. But otherwise, I just want to take a second to ask you to please take a few minutes now to complete our survey. Tell us what you liked, what you didn't like, what we could do better, suggestions for topics for future education, as Mary calls it, your wish list. Send that in on the survey. It doesn't have to be specific to Medicare. Earlier, I did a demo of the website. It can be something like that. But we want to know what your ideas are. It doesn't even have to it doesn't even have to be education specific. So if you have something like our process could be better, let us know that too. We have made changes based off of that. We have YouTube chapters on our videos now. We've added training indicators in our specific descriptions for our webinars so you know what you're getting into. So on mine, it would say NTM, new to Medicare, so you know it's for new to Medicare people. But let us know. Your feedback really is invaluable to us and ensuring education that is timely and effective. There are different options to take the survey depending on your preference and what's easiest for you. You can use that link that Mary put in the chat, or when you exit the webinar, you will be asked to go to the external site. It'll look like this. This is not malicious. This is not scary. This is not anything, we're not pulling a fast one on you. It's just telling you that it's taken you to an external site. This is the external site for the CMS page for that survey. And it'll just like this on the page that's on the window that's on your screen. So please just it takes a couple of minutes, just take some time and let me know on that survey what you're thinking. And thank you in advance when you do as well. And so with that, on behalf of myself, Mary, and Provider Outreach and Education, thank you for your participation. We look forward to your survey comments and hope to have you join us for future events. Have a good day, have a good week, have great holidays. You may now disconnect.